For my quality improvement project, I chose to use New Hanover's general procedure for IV therapy, focusing on the change label section. I chose this section because over the past 2 years in clinicals and 3 years as a CNA, I have walked into numerous patient rooms and seen several IV tubing hanging with no real indication of how long they've been there. We have been told over the past 2 years how important patient safety is, and I wanted to pick a policy aimed at reducing risk to patients, and I feel this policy does that. 30% of all hospital-acquired infections come from IV catheter infections. To evaluate this policy, I inspected 100 patients' IV tubing sets over several shifts at New Hanover. Out of 100 IV tubing sets, only 21 were labeled correctly, 62 were not labeled at all, and 17 were labeled, but the date for them to be changed had passed. I interviewed several nurses to understand why so many IV tubings were not labeled. They said that the IV tubing labels and the IV tubing is in 2 separate places in the PAR. So when they go to grab the IV tubing, they often forget to grab the labels. To correct this problem and to improve this policy, some recommendations would be putting the IV tubing label beside the IV tubing. Also in Epic, the nurses have to document on the IV site and the day the IV needs to be changed. If there was a space to add where the nurses had to document on the tubing change date, I feel more nurses would label the tubing. After talking to several nurses, I learned that the only education on this policy was in orientation, which for many had been years ago. Adding in services on IV catheter infection will remind nurses how important it is to change the tubing, thus reminding them how important it is to label it. The CDC recommends IV tubing be changed every 96 hours for continuously used sets, including secondaries. This reinforces the requirements in this policy. Increasing audits on tubing labeling will also help increase the adherence to this policy. However, during the time that I chose this policy, there was no real audits going on for this policy. Infections cost the hospital millions of dollars, but it can cost the patients even more. If the patient has an underlying comorbidity, an infection could increase that comorbidity and cost them their life. As a nurse, it is our job to keep our patients safe, and I feel like this policy helps do this. Labeling the IV tubing decreases the number of IV catheter infection, thus increasing our patient safety.